Hello everyone, my topic is about driving and community mobility. In this discussion, I will distinguish the different ways that OT can help individuals, especially older adults, engage in the occupations of driving and being mobile in their communities. The outline of this presentation will go over the population I chose, Healthy People 2020 goal, the role of OT, specifically screenings, evaluation, and interventions, local and national resources, key considerations, and finally questions for you. Health strategy is about maintaining safe community mobility behaviors for individuals in late adulthood. Specifically, this is about driving and the use of community transportation so that way individuals in late adulthood can participate and contribute to their own health and wellness. The CDC shared that in 2017, almost 44 million older adults over age 65 had a driver's license, and about 20 older adults get into a fatal motor vehicle accident every day, with an additional 700 older adults getting injured from a motor vehicle accident every day. Per my research, it shows that the older adult population engages in safer driving behavior compared to the younger population. It's when they start to experience these age-related cognitive declines that is when their driving independence and community mobility independence becomes affected. So the research that I found, a lot of natural age-related changes that occur just as you age are hearing loss, decreased visual acuity, short-term memory loss, slower processing speeds, and word-finding difficulty. And that can affect driving and community mobility behavior. And then health conditions that commonly emerge as you get older are dementia, orthopedic and brain injuries from falls, diabetes, and osteoarthritis. So all of those factors can somehow affect an older adult's ability to be able to drive safely and to safely and independently go out into their community. The Healthy People 2020 goal that relates to this topic and health strategy is to improve health-related quality of life and well-being for all individuals. It includes 3 different domains: self-rated physical and mental health, overall well-being, and participation in society. The health strategy connects to this Healthy People goal because when older adults are able to successfully and independently drive or engage in their community through community mobility resources, then they're able to participate in those meaningful activities that give them purpose in life and contribute to our overall health and wellness, which is pretty much what occupational therapy emphasizes. When I researched further into this topic, I found some parts of the OT process that we all apply in other populations and other occupations. So, first and foremost, when you are interested in targeting driving and community mobility, you want to do a screening to see if that individual would actually have any OT needs for driving and community mobility. So the driving screenings that most people do are some things like car fit, which I'll explain that resource in a little bit, but doing things to see the fit between the person's abilities and the demands of the vehicle to operate it and to operate it safely on the road. You can also measure an individual's driving abilities through observation of their performance on other complex IEDLs in their household. So if it's cooking, laundry, all of those multi-step complex IEDLs, you can kind of measure their client factors, performance skills that are underlying in those IEDLs that often are a part of the driving skills needed to be safe on the road. So if you ever are limited in resources to not be able to be in direct and in the car to observe how they operate their vehicle, sometimes you can just do those indirect observations of their IADLs. One resource that an OT could use in their screening process is the Spectrum of Driver Services. It's a detailed and thorough document that outlines all of the services that an OT can look at and guide their clinical reasoning process for where that older adult would possibly need to go, whether it's an eval or the intervention resources that they could benefit from. So it's very thorough and detailed, and it would take me probably another presentation just to explain it, but it's really great because it's pretty much just an outline that OT could use to guide that process of deciding, okay, do I need to refer this individual to an eval, or what's available in their community that they could just try out. This visual is yet another resource that an OT can use in the screening process. It shows the best decisions to make based on the risk that the older adult poses when they are performing those tasks of driving and community mobility. So, whatever you see in that indirect IADL performance, or what the individual or caregiver reports, you can look at this visual to determine what the next step should be, whether it's discontinuing driving or referring them to a certified driving rehabilitation specialist, or figuring out what interventions you could do yourself to support those client factors and performance skills to help them engage in driving and community mobility. The occupational therapy performance appraisal for driving is yet another great resource for therapists to use in the driving screening process. So it looks at the client factors and performance skills that are underlying in those complex home IADLs and how those connect to the performance skills and client factors that are a part of driving. It looks at strategic, which is the overall cognitive ability decision making process to execute that overall occupation, the tactical, which is about the specific performance skills to complete each step of that occupation, and then the operational, which is the interaction of the human with the environment, the object, to be able to complete that task. The screening process is going to dictate what happens for the eval. So if the individual shows those high risks from those simple observations of their IADL performance, then you're going to want to just recommend that they discontinue driving instead of referring them to a DRS and get an eval, because it's just going to be a repetition of services since the DRS is going to find the same thing. Now, if you, just like that stoplight, if they do have a lower risk and they have those just underlying performance skills that just need to be worked on, then you can refer them to a DRS and they will do a more thorough eval. And with a DRS, it doesn't just have to be an occupational therapist. It can be any type of healthcare provider that's certified and has some type of connection with driving and community mobility. Interventions can go in a couple different directions. If the individual has discontinued driving, then it might be a modify adapt approach of them learning how to use those community resources. You might teach them those skills for being able to utilize those community resources or just educate them. Another way that you could go is if you are a DRS, you might be involved in the modification of their vehicle for them to be able to participate and drive safely. And then another way that you could also help them with their driving abilities is to work on those complex IADLs that are in the home environment, since there's a lot of connection and overlap. A couple national resources that I found beneficial, which I'll provide the links to, are the Driving and Community Mobility page on AOTA, which provides a number of articles and literature in addition to the locations for driver rehabilitation specialists. And then the Senior Driving AAA website, which also shares some educational materials and provides those resources for locating driving rehabilitation specialists and the car fit screenings. As for local resources, the Mid America Regional Council also provides resources in the Kansas City area about local organizations that offer driving evals and rehab, and then also local transportation providers and the national local organizations that offer education. And then the Kansas Revenue website also provides a list of more driving rehab facilities in Kansas, Missouri, and Nebraska. And then it also provides some of that prerequisite information for what you need to have with you when you are trying to seek out those services at those rehab facilities. I apologize for going a little bit over, but my three closing comments are: first, there needs to be more research on other populations whose driving and community mobility needs are affected. I focused on the older adult population because that's what a majority of the research talks about, and the older adult population, they grew up with cars and when they first came out, so that's a huge priority and it allows them to engage in those meaningful occupations. But other people also utilize cars and community mobility to achieve their level of health and wellness. So looking at other populations who are affected by it would be important. The second thing that I want to emphasize is that in order to determine whether an individual should drive or not, it's based on the licensing authorities. So that interprofessional collaboration of talking with the individual's doctor, of letting them know, like, hey, yeah, I support this decision to keep them from driving, and then or to discontinue them from driving, and then also to let them know like, hey, actually, like they have some strengths, like we can work on this, so like let's not write them off yet. So collaborating with those doctors so that way that person can have an advocate for them and engage in those community occupations. The third one that I want to talk about is the context, is just thinking about how when they're driving, there's are different contexts for the driving demands. So it's going to look different in the city compared to the country. So considering that when you are doing those screenings, or even if you do want to be a DRS, considering how those demands might be different and vary according to population, especially on the research that is conducted on those different demographics and geographical areas. Now, my question for you that I want to ask is, what do you think are the limitations of doing those indirect IADL screenings? I talked about the benefits and the research that supports doing those indirect IADL screenings at home and seeing how those can possibly extrapolate to how their driving behavior would be and driving performance. But what do you think would be the limitation in mainly looking at their home IADL performance?